Good day, everyone. I'm Jordan, the moderator for this webinar. I welcome everyone to today's webinar, which is 2026 Medicare Enrollment Form 855 Updates. I want to introduce our presenter for today, Tony L. Holmes. Tony L. Holmes, CCS, CPC, CPMA, CRC, AHIMA approved ICD-10 CM PCS trainer, is an internationally known speaker and recognized subject matter expert on medical coding, reimbursement, compliance, and revenue cycle management. She holds multiple credentials with the American Health Information Management Association, which is AHIMA, and the American Academy of Professional Coders. I would now like to hand over the floor to the speaker. Over to you, Tony.
Thank you so much for that introduction, and thank you to all of our attendees today. I'm so excited to be talking to you today about the 2026 Medicare Enrollment Form updates. As our moderator mentioned, my name is Tony L. Holmes, and I'll be your presenter for today's session. Everything about the session and how I approach presenting comes with the lens of compliance and really thinking about worst case scenario. And so with regards to Medicare enrollment, this is ultimately where I see so many gaps and so many issues on the reactive compliance front and in litigation and in situations where hospitals, health systems, medical providers are having to pay back significant amounts of money for misrepresentation or maybe just an error that they didn't realize was as severe as it is. And then specifically today, we're going to focus on what that process looks like. We're going to talk about PECOS, what's going on with PECOS 2.0. We're going to talk about the enrollment updates, and then we'll try to go through some of the applications together and just kind of discuss some of the common pitfalls and challenges and ultimately compliance considerations with regards to Medicare enrollment forms. Basically, the provider enrollment process, and then within the Medicare program, this is where it gets really important to understand how the different parts of Medicare work, because that directly impacts the enrollment process. Medicare, traditional Medicare, is a participation-based enrollment, whereas Medicare Advantage is administered through private health insurance companies. It is the online version of the 855 forms. So it's basically Medicare's online version of the 855 forms, the provider enrollment chain and ownership system, or PECOS for short. Basically, these forms are already automatically embedded into PECOS. So essentially, if you're revalidating, updating, brand new enrollment, you can do that one of two ways. You can do it using the paper applications. With regards to your MACs, these haven't changed, I believe, since 2024. Make sure you have all of the information in order. So provider contact information, mailing addresses, the MPI, NIPS, MPPS repository. This is free. Anybody can access it. It has gotten a little bit more difficult to use now. I think that they restrict how many searches you can do in a time period, that kind of thing. In terms of the application fees, so this is one of the changes for 2026. It's not a huge change. Make sure you check things like the OIG exclusion list, CMS preclusion list, the National Practitioner Data Bank, or NPDB. So some common things as we wrap up: missing dates, signatures. Make sure that the people that are signing the enrollment forms are the authorized official or the individual provider. Otherwise, they're going to get kicked back. Surrogates cannot sign the forms. Staff and users cannot sign the forms. You have to make sure it's an authorized official. And then another huge thing that I'm seeing on the enforcement side is billing companies or billing agents. Thank you so much for your time and attention today. If you think of a question after our session today, feel free to reach out. I'll be happy to answer any questions you might have. I hope that this has been valuable to you, and I hope you have a great rest of your day.
Thank you, Tony. That concludes the session for today. Thank you, everyone, for participating. You may all disconnect now. Have a great day ahead.